Patient Protection and Affordable Care Act has created significant changes for both business owners and individuals. Part 1 of this presentation will focus primarily on the changes on business owners. Part 2 will focus primarily on the changes to individuals. Whether you are a business owner or individual, you may wish to consider viewing both presentations. By viewing Part 1 for business owners, individuals may obtain a better understanding of why employers are making changes to their plans, as well as why employers are sending communications about their plans to their employees. Business owners will benefit from viewing Part 2 because these are the issues that their employees will be facing. Your presenters are Frank and Brian Harlander, the co-founders of Keystone Financial Solutions. We help business owners increase their cash flows and profits and who want to retire early and comfortably. We also work with individuals to minimize the taxes they pay and the proper plan for their retirement and family's financial needs. The new law is quite complex and far-reaching for both employers and employees. This presentation will cover the more significant changes and provide you with planning considerations when applicable. Due to the complexity of the law, many business owners may see an increased cost to comply with the new provisions of the law and will find that they need to consult with specialists such as healthcare brokers, attorneys, and CPAs. The complexity of the law is not restricted to business community, as some individuals will find the preparation of their individual tax returns to be more complex and perhaps more costly. Anyone who has been following this law is aware of certain effective dates that have already been postponed and other effective dates that may be postponed. Thus, this presentation did not focus on effective dates. Thus, it's important for all taxpayers to work closely with their healthcare providers to ensure compliance with respect to the due dates. The simple answer to the question of what is healthcare reform is that everything about healthcare is changing and will likely continue to change as the law is rolled out and fully implemented. Thus, while you are an employee or an employer, you will be facing new challenges with respect to healthcare. Complexity, complexity, complexity. This likely best describes the challenges that employees and employers will be facing. Our recommendation is not to fly solo, but to seek professional help. With so many pages of Internal Revenue Code and IRS regulations existing, there will be several issues that the courts may have to eventually clarify. In the interim, it's best to work with a professional so that you can avoid potential pitfalls of trying to comply with this law on your own. There has been much publicity about large companies dropping their healthcare coverage or decreasing the number of full-time employees to reduce healthcare costs. Small business owners need to consult with their advisors to determine the best course of action. As the business community reacts to Obamacare, individuals will find themselves facing new challenges about their healthcare coverage and how to pay for it. The employer challenges are daunting. Employers need to understand the law and the requirements to educate and communicate the law to their employees. Employers who in prior years absorbed all or most of the increase to provide their employees with health care coverage will now be faced with another decision. The new question being asked by some employers is, should the employer pay the cost of health care or pay the penalty? One of the driving factors in prior years for the employer to provide health care coverage to its employees was the employer felt compelled to do so to remain competitive in the employee hiring marketplace. If the business owner sees that his or her competitors are no longer offering health care, can the business continue to offer health care to its employees? If employers find that it's cheaper to pay the penalty than to provide health care, will that business have a competitive cost advantage over its competitors? Since health care insurance is now available to everyone, employers are no longer the sole source for health care coverage. Employees now can obtain coverage via federal, state, or private insurance exchanges and through public programs. Employers who find their current health care plans is too expensive need to understand that if they change their current plan, their plan may not be grandfathered under the new law. Thus, employers need to understand the grandfather provisions will be discussed in a later slide. The last bullet above, the standalone plans, are not covered by the new law. One of the advantages of a grandfathered plan is that the health care plan does not need to cover pre-existing conditions. Since a grandfathered plan may provide for less coverage than a plan that must meet the new health care law provisions, these plans could conceivably be less expensive. While we said we would not focus on effective dates, a grandfather plan must have been put in place as of March 23, 2010. There are different rules for grandfathered individuals and group policies. The first two bullets on this slide describe some of the differences between a grandfathered individual plan and a grandfathered group plan. You likely have heard commentators speak about the platinum, gold, silver, and bronze plans. Non-grandfathered plans must meet these metal thresholds. You will note on this page that an asterisk follows some of the bullets. These asterisks indicate that another page follows that provides more details. For those employers who make changes to their grandfathered plans without consulting with a healthcare specialist, they run the risk of losing their grandfathered status. Simply failing to disclose to your employees that you have a grandfathered plan, or failure to maintain the required documentation, results in the plan losing its grandfathered status. The examples listed on this slide illustrate that if an employee costs for health care increase beyond the parameters allowed, the plan will lose its grandfathered status. This slide simply shows two other conditions that could result in the loss of a grandfathered status. If you believe that you have a grandfathered plan, after consulting with your healthcare specialist, you must disclose to your employees that you have a grandfathered plan and include that disclosure on all plan documents, whether they are distributed to employees or not. It may not be a bad idea to have employees sign a statement that they acknowledge on which date you disclose to them that you have a grandfathered plan. Again, consult with your healthcare specialist. Work with your healthcare specialist to ensure that the company documents adequately disclose your grandfathered plan and that you must maintain these records in a secure location so that they can be retrieved when needed. If the employer eliminates a key healthcare insurance benefit, the grandfather status is lost. The second bullet provides a good example of how cherry-picking the eliminations of benefits can result in the grandfather status being lost. This slide lists the key benefits that must be provided without any annual or lifetime benefit changes to the grandfathered plan. If the employer requires the employee to pay more for coinsurance, deductibles, or copayments, the grandfather status is lost. The law views these changes as directly affecting those who need medical care rather than the employee population as a whole. Logically, this makes sense, as only those who seek medical care would pay the deductibles or copayments. The slide does illustrate that certain costs to employees can be increased, but only within certain parameters. While we realize we are being repetitive, again, this illustrates the need to work very closely with your company's healthcare service provider. A brief description of how reducing employer contribution rates can result in the grandfather status being lost. And changing the annual or lifetime benefits can be problematic. Another slide that illustrates examples as to how changes to the annual or lifetime benefits can cause employers' plans to lose its grandfather status.